On this edition of Veterans Health Watch, we'll learn how the VA Maryland healthcare system is helping men and women returning home from service to our country. Please join us. Welcome to Veterans Health Watch, a program sponsored by the VA Maryland healthcare system that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm Kenya Griffin. The VA Maryland healthcare system serves veterans from World War II to young adults returning from combat service and starting a new civilian life. That's why we have a multitude of programs to help these veterans. Joining us today is Jim Wilkes from the Transition and Care Management Service. Jim, thank you so much for joining us.
Thanks for having me, Kenya.
So Jim, your program has been in place for several years, but I understand you have a new name, Transition and Care Management Service. Explain that title to us.
Well, what we've done is we've transitioned from just taking care of post 9/11 combat veterans to helping all separating veterans from post 9/11, whether they're combat or not. So central offices asked us to change our name to reflect that. So instead of just being OEFOIFOND, we are now Transition and Care Management, helping all post 9/11 veterans transition into VA health care.
And by central office, you mean this is a national transition. The VA medical centers across the country have changed the name of this service to Transition and Care Management.
Yes, we have a new standardized logo and a new standardized program now.
So you're all new. Great. I'm glad you're expanding the services. Could you give us some examples of some of the challenges that the men and women face when recently returning from service?
A lot of our younger veterans have gone into the service right out of high school, so they've never had a structured life on their own. They've always had someone making decisions for them, whether it's mom and dad or their coaches in school, to then their drill instructor and then their senior sergeants in the military. So when they come out of the service, they face with a whole new set of issues and opportunities that they really haven't faced before. So what we try to do is help them get through that transition period and then help them to make decisions on their own and set out their life's goals and plans.
Jim, you mentioned that the services have expanded to non-combat veterans as well. Can you tell us more about the enhanced access to healthcare services for veterans through this program?
Yes, of course. So with this newer generation of veterans, the VA has decided nationwide to have dedicated providers both in mental health and physical health for their issues and their conditions. And here in the VAMX, we have several clinics dedicated to post 9/11 veterans and special services now that have been established, like polytrauma, post-traumatic stress syndrome, women's health, for example. We've expanded women's comprehensive health exams and compensation programs greatly.
Great. And I know that your department helps, or your service helps veterans with more than just access to health care. So can you tell us about some of those services that are available, and what else do you offer or help veterans with?
Yes, we believe that taking care of our veterans, it's not just a matter of keeping appointments or taking medications. It's the whole experience, whether it's social activities, getting a job, going to school, starting a family, whatever these veterans want to begin with or want to help with, then we try to assist them with that. We refer them to community services. We also have service officers that help them with their benefits, whether it's education, home loans, and then we also refer them to our vet centers as well.
And I know you work as a team. Tell us more about the team and what the different professions are in that team that works with the veterans.
Well, thank you. We've expanded our team. When we first started this program, there were just 3 members. There was a program manager who was a social worker, and then a case manager who is a nurse, and then myself, I'm the transition patient advocate. We've now expanded our services to reflect our growing population. We have 2 nurse case managers full-time. We have a polytrauma TBI case manager who's a social worker.
And TBI is traumatic brain injury?
Sorry, yes, traumatic brain injury. And then we also have 2 Army Wounded Warrior advocates who work with our retiring Army veterans who have combat injuries that they help transition from DOD life into civilian life.
And so what can a veteran expect when they walk into the VA Maryland healthcare system? They're newly returned. How does your service, go through the steps, how does your service help them? How does your department help that veteran? How do you work together?
What we do is we try to make sure that they have a point of contact with our service that acts as a buffer between the VA healthcare system and themselves. So they don't have to worry about having too many people to try to contact or try to reach out to. We give them a single point of contact, whether it's one of the nurses or one of the social workers as a case manager, or even myself, just for information and resources. So if they have questions or difficulties, that they know that they can call us and they can get assistance, whether it's making an appointment, meeting them at the door, guiding them through their clinic so they can find their doctor, their provider, or even helping them when they have, problems with directions getting to the facilities.
And I know you do some outreach, because we want these veterans to know before they even get out of the military, or as soon as they're leaving the military, that this service is available to them. Tell us about some of your outreach efforts. How do you get the information out to our veterans?
So that's a big part of our program, and that we first started with that when the program first started back in 2006, 2007. And the VAMICS was actually the first VA in the country to do a post-deployment health reassessment at the facility. All the other states had done those at either the guard units or the armories. We were the first ones to have them at our facility, so the veterans, the soldiers, could see what their VA facility looked like, where it was, how they could get access to it. And then what we do is we have 4 stages where we meet with the veterans. Stage 1 is when they first return home from combat. We give them a little information about VA resources. Stage 2 is 30 days post-deployment. Stage 3 is 60 days, and then stage 4 is the 90-day, and that's the one where we have them at the medical center, and if they need follow-up, we have providers there that can help with assistance with making appointments or doing evaluations.
Jim, how does your team help to connect veterans to services outside of just VA healthcare?
Well, what we do is we try to link them with community resources for any social needs that they may have, financial assistance, that sort of thing. And then also we link them with service officers for assistance with their benefits part, claims, compensation, education. And then we also work with the vet centers very closely to refer them out in the community for help with mental health issues.
That's great. I'm glad you mentioned the Vet Center. I actually had an interview with John Danziger from the Vet Center. So we're going to take a short break, and when we return, we'll see more of my interview with John Danziger from the Vet Center. So please stay tuned.
I'm good.
I'm good.
I'm good.
I'm good. But I have a story, and I don't know where to start.
I'm good. But I feel alone in a crowd.
I'm good. But nobody understands.
I'm good. But the past keeps coming back.
But I can't get out of bed.
And I can't sleep.
I'm good. But I feel overwhelmed.
I'm good, but I don't feel safe.
But I don't even know who I am anymore.
But I still have nightmares.
But I don't need any help.
I'm good. But I don't feel anything anymore.
I'm good. But I can't live like this anymore.
I'm really not so good. But are you ready to listen?
I think one of the exciting campaigns that the VA Maryland healthcare system has embarked on is the Televet campaign. As a veteran myself, I'm really more interested in what a fellow veteran's perspective on their healthcare service is going to be. So I would really encourage all of our veterans who have been to a VA Maryland healthcare facility to tell fellow veterans about their experience.
I wish someone would have told me about the VA healthcare years ago. If you see a veteran, ask them if they're using VA healthcare.
Make a difference. Tell a vet.
Welcome back to Veterans Health Watch. Earlier, I had a chance to interview John Danziger from the Vet Center. Let's go to that interview. John, thank you so much for joining us today.
Oh, thanks for having us.
Explain to us first, what is the Vet Center program?
So the Vet Center program actually started back in 1979 after the Vietnam conflict, and it's a program that's part of the VA medical system, and our mission is to provide readjustment counseling services for combat veterans and their families at no cost.
And where are the Vet Centers located in Maryland?
Well, in the state of Maryland, we have 8 of them. There's one in Elkton, Maryland, one in Aberdeen, one in Dundalk, one in Pikesville, one in PG County, and one in Annapolis and Silver Spring.
Okay, good. So it sounds like you're spread out throughout the state.
We are. Pretty much goes all up and down the 95 corridor, situated near major military bases.
Good. And so you mentioned combat veterans use the services. Who else is eligible, or can you give us a little more details about who's eligible to use the Vet Center?
Absolutely. So for the main eligibility purposes, if the veteran served in a combat zone of Iraq or Vietnam, Panama, Grenada, Somalia, Desert Storm, they're eligible to use Vet Center services. But if they're not, we can still see them up to 3 times before we refer them to a community provider or refer them to the VA hospital. And also one of our services is military sexual trauma. We have a licensed military sexual trauma counselor at each Vet Center, and the vet doesn't have to be combat eligible to utilize that service. So if a man or a woman was sexually assaulted overseas or in the States, they can come in, no questions asked. They bring in their DD-214, their discharge papers, and they can receive therapy for that.
Great. And you also mentioned families. It's great to hear that. We always say that a veteran never serves alone. The family serves with them. What type of services do you offer for families?
Absolutely. So we do family and marriage counseling. That's one of our big ones. The husband can bring in the wife, or the wife can bring in the husband and receive family and marriage therapy. Sometimes there's a disconnect between the spouse when a veteran has deployed 4 or 5 or 6 times. So they can utilize the Vet Center at no cost to receive family and marriage counseling from a licensed family and marriage therapist. And we also do bereavement counseling. So, if a mother or a father has lost a child on active duty, they can come in and receive bereavement counseling from one of our counselors too. They do home visits sometimes. So bereavement counseling is a big part of the Vet Center as well.
And I know that the Vet Center offers, like you said, it started in the 70s after the Vietnam War, to offer a more intimate setting for the veterans where they feel comfortable. Describe more of the services and referral services that you have there at the Vet Center.
Sure. So we do individual counseling where a Vietnam veteran or Iraq veteran can sit down with a counselor and receive that one-on-one counseling. We also do group counseling where you might have 10 or 15 Korean War veterans in a group, and one of our counselors facilitates that group. The Vet Center, it's long-term, so it's not like after 12 sessions we refer them somewhere else. We don't. We've had Vietnam vets coming in for the last 15, 20, 25 years. We've had Iraq and Afghanistan vets coming in since 2003 when the war broke out. So the services at the Vet Center are long-term and absolutely at no cost. There's no co-payments, no bills. Sometimes at the VA medical centers there's a payment associated with services. Vet Center, all the services are at no cost.
That's absolutely wonderful. And what about the mobile Vet Center? So you're located throughout Maryland, but you also move around. Tell us about the mobile Vet Center.
We do. So the mobile Vet Center, it was designed to bring our services to rural veterans.
Okay.
if a veteran can't get into a vet center, if they live 50 miles or 100 miles, if they're outside kind of the perimeter of a vet center, we'll deploy that mobile vet center to their area and outfit it with one of our counselors. And it's set up where there's 2 private offices in the mobile vet center. I mean, it's a huge 39-foot RV. So our driver takes it down to St. Mary's County, for instance, and sets up shop in a Walmart parking lot with one of the counselors from the PG County Vet Center, and they're able to reach some of the rural veterans that live in PG County.
Are those on an appointment basis? Does a veteran have to call in and schedule? How does that work?
Mm-hmm. Usually the veteran calls into whatever vet center they're closest to, and they can find out, if the mobile vet center is going to be in PG County or St. Mary's County, and they actually schedule the appointment with their counselor, and from there they'll arrange the location and time of it.
And are most of your sessions based on appointment? Do you have walk-in hours?
We absolutely do have walk-in hours. Most of the time they're by appointment, but if a veteran comes through our door that day and has nothing scheduled, they will absolutely be seen by one of our counselors.
Right.
Yeah.
And you're well connected with the VA medical centers, even though you all fall under VA Health Administration, but you're also connected and work. How do you work well with the medical centers?
Absolutely. So the VA Medical Center is basically our parent organization, our parent agency. So we do a lot of referrals to transition care management, the OIF, OEF team, a lot of referrals to some of the providers on Perry Point or at the Baltimore VA Medical Center. And it's a good working relationship because the hospitals also refer veterans to us. Okay. So it's definitely a good working relationship between the vet centers and the VA medical centers.
Okay, great. And you mentioned the OEF, OIF. I know that's Operation Enduring Freedom, Operation Iraqi Freedom, and they do a lot of case management. How do you work specifically with that program for our newer returning veterans?
Well, we do a lot of outreach events with the Iraq Afghanistan team at the VA hospital. If they have a veteran who needs therapy services, but they don't want to receive it at a VA hospital, we definitely get referrals from that team for the different Iraq, Afghanistan vets in the community.
So what would you say is a difference if someone's saying, okay, what's so different about a vet center and a medical center? What would you say is the difference?
Well, the vet centers, they're all detached from the hospital. You won't find a vet center in a hospital setting. We're more or less out in the communities. We're embedded in the neighborhoods. And one of the biggest things is that a veteran doesn't even have to be enrolled in VA healthcare to use a vet center. All we need is their discharge papers, and we can verify if they were in Iraq or Vietnam, if they have a Purple Heart or a combat action ribbon, anything of that nature. We can verify their service and where they were, and then they can just start rolling with vet center services. So access to care is pretty easy. Usually within 3, 4, 5 days, they're hooked up with their counselor.
Okay. So you described a plethora of therapy and services offered at the vet center. Is there anything else you'd like to tell us about the vet center that we haven't covered?
Sure. So one of the other services we provide, since we are part of the VA Medical Center, sometimes we get walk-ins and they have questions about just navigating the VA, whether it's the benefits administration or the cemetery administration. So whatever questions they have, we don't say no, we don't do that, or try someone else. We bring them in and sit down with them and really try and explain how the claims process works, how the cemetery administration works, how to enroll in VA healthcare and what forms they need. And we'll sit down with them and fill out that application with them. So we more or less try and help them out with the entire VA system.
And tell us how we can find out, or how veterans can find out more about your services, or where to find a location closest to them.
Sure. Well, they can go online and visit our VA website. It's www.vetcenter.va.gov. And we also have a live 24-hour hotline that's staffed with counselors. And that number is 1-877-927-8387. So that's the 2 ways they can reach us.
John, thank you so much for being here with us today, and thank you for all you do for the veterans who use your services.
Thank you, Kenya. Thanks for having us today. Really appreciate it.
Great. When we return, we'll pick up our interview with Jim Wilkes from the Transition and Care Management Service. So please stay tuned.
There are numerous benefits for a veteran to enroll in the VA Maryland healthcare system. Number one, they get excellent health care. There's a great pharmaceutical service. They have specialists in all of the areas and use cutting-edge technology. And we have a very good electronic medical health record.
You can keep your current provider as well as come to the VA.
For our veterans, no matter whether they live in Central Maryland or Eastern Maryland, our clinics are conveniently located to where they live throughout Baltimore and the Eastern Shore.
The fact that there are other veterans here that I can talk to and share common experiences with.
The amount of medical attention that I receive has been excellent.
The VA Maryland healthcare system is your VA. It's America's VA. It's the veterans' VA.
Since I've enrolled at the VA, it has been a great decision, and I encourage every veteran to enroll. They will not regret it.
We all have the ability to touch the lives of those around us. Sometimes, even the smallest act has the power to change a life. Hello.
Hi, Dad.
Reach out to the veterans in your life today. Let them know they're not alone. That's the power of one. One simple act can make all the difference.
The Appointment Call Center is a fast, easy, convenient way for a veteran to call in to schedule, change, or cancel an appointment.
You can reach any of us by calling 1-800-463-6295, extension 7333.
The call center is open Monday through Friday from 7:30 a.m. till 5 p.m. If you need help scheduling an appointment, call the call center because we're here to help.
Welcome back to Veterans Health Watch. I've been speaking with Jim Wilkes from the Transition and Care Management Service. Jim, thank you so much again for joining us.
Thank you.
So let's continue. If you could please explain for us again, who is eligible for the Transition and Care Management Service program?
Well, Kenya, all veterans that have deployed since 9/11 are eligible for our program for care management. We do service both combat and non-combat veterans. However, the non-combat veterans, after they get set up with their primary care providers, then their care is managed by those providers as opposed to our service.
Okay. And for the combat veterans, I understand there was a 5-year time frame that they're eligible for certain services. What happens once the 5 years runs out?
Once the 5 years runs out, and the 5-year period refers to free care from the VA for any service related to their deployments. After that 5-year period, they can still receive care, but based on their income, they may have to pay a copay for either prescriptions or for visits, outpatient visits or hospital admissions, but they're still eligible to receive care.
Okay, great. Thanks for clarifying that. Is there a deadline to enroll?
There's no deadline to enroll per se. Veterans who have gone past their 5-year window from their date of separation can still enroll for health care with the VA because of their combat, but if they've waited past that time, the copays may apply because of income restrictions. The other service, though, that they also may lose is from the date of separation, they also have 180 days to get a dental exam from the VA if they didn't get one while out processing. So we encourage all of our veterans to enroll as soon as possible, even if they don't feel they're having any issues. We want them to go ahead and get enrolled into the VA healthcare system, and then that way if issues do come up, they don't have to worry about, did I miss my deadline or not.
And I know from experience it's important for veterans to understand it's not, the enrollment in the VA healthcare system isn't automatic. You actually have to complete an application and enroll, so it's important that you take that step, as you said, even if you don't use the services immediately.
Correct.
Excellent. So how can a veteran enroll then for VA Maryland Healthcare Services?
It's actually very easy. They can go on to the website, the www.maryland.va.gov, and then click on the Become a Patient, and then they just need to submit some information. They can come to our enrollment center at the 10 North Green Street facility or at any of our 9 locations throughout the state and enroll at any of those facilities. And then once they get enrolled, they're certainly welcome to call our office and then get set up with our services if need be.
And Jim, I understand even though your department or your service has a new name, you've actually been doing this for about 9 years now. Tell us about some of the feedback you've been getting from veterans.
When we first started doing this, it was a very small portion of the veterans population, and so we weren't quite as busy. And our veterans, we were able to give a lot of one-on-one attention to. As we work with our veterans, we develop a relationship with them and they feel comfortable talking with us. There was a lot of initial pushback from our veterans in coming to the VA for healthcare services, but after we started working with them and we did persevere, by word of mouth they started talking to their other battle buddies, other service members they served with, and so they let them know, look, it's not as scary, it's not like we thought it was, it's not about all the rumors that you see on TV. These people are really here to help. And then once we engage them in care and they get to meet their providers and they feel comfortable with them, then it's a whole different experience for them.
And the word of mouth means everything.
It really does, because they trust each other to tell each other the truth and to let them know this is good, this is not good. So when they tell them, look, you got to give this a try, you got to call these people, then they feel that that's the best way to go.
Absolutely. And for those veterans who haven't heard of the service, or some military people who are still active duty, or family members who are maybe looking out for their soon-to-be veterans, how can they get in touch with you?
Very easily, a couple of ways. They can go on the website, again, the www.maryland.va.gov, and then at the bottom of the page where the yellow ribbon is, click on the button that says Returning Service Members, and it'll take them directly to our web page. It'll list all of our team members, how to contact us, or if they want, they can just certainly call our direct line at 410-605-7259. We'd be glad to talk to them and get them started in our services.
Well, Jim, thanks again for joining us and for all the work you've been doing for our veterans.
Thank you very much, and thanks for having me.
Well, we're out of time for today's show, but if you have questions about today's topic or have suggestions for future topics, please call us at 1-800-949-1003, extension 5407, or visit our website at maryland.va.gov. You can also follow us on Facebook or Twitter. And remember, if you are a veteran or you know a veteran who is not using the VA Maryland healthcare system, please give us a call at our enrollment center at 1-800-463-6295, extension 7324. Visit our website or come to any of our VA outpatient clinics or medical centers. We look forward to serving you. Please see us next time.
Volunteering is an opportunity to show your patriotism.
Most importantly, it's a good feeling knowing that you're helping those who have already served.
And it's always an honor and a privilege to me to be there because I know that I get to help the men and the women who have served us.
So if you're interested in volunteering with us, best thing is to get in contact with us through our webpage, or you can also call us.
It really, really gives me an opportunity to give back, make a difference.
Hey, Daniel. The gentleman over there, he paid for your meal.
The power of one small action, one conversation, or one phone call can make a difference in the life of a veteran going through a difficult time. For free 24/7 confidential support, call the Veterans Crisis Line or the Military Crisis Line.